In today's video, I'll be sharing with you guys how to prevent and treat post-inflammatory hyperpigmentation. Hello guys, welcome back to the channel. I'm Dr. Janet of jdiva.com, and on this channel we talk on natural hair care, skin care, personal development and productivity tips. And if these are the kind of topics you love, please consider subscribing and turning on the notification bell so you know when I upload another video. Post-inflammatory hyperpigmentation, also known as PIH, is darkening of the skin that arises after our skin gets injured or irritated from various causes. Now, it occurs in all skin tones, but it's particularly more severe and more common in those of us with darker skin tones. And this is as a result of the presence of more melanin. And melanin is a pigment that is responsible for our skin color. So the darker you are, the more susceptible you are to forming post-inflammatory hyperpigmentation when your skin gets irritated. Now, post-inflammatory hyperpigmentation can arise from any trauma to the skin. Now, it is a direct effect of the body trying to heal itself. Now, following an injury or an irritation, the body tries to heal itself. There's redness, there's swelling. This is called inflammation. Now, these inflammatory cells now trigger the melanocytes. Now, the melanocytes are the melanin-producing cells on the skin. When this melanin is produced, they are now deposited around this area of trauma. So with more inflammation is more melanin production. So in chronic inflammatory conditions of the skin, people who suffer from this tend to have more post-inflammatory hyperpigmentation than the general population. Now, the number one cause of post-inflammatory hyperpigmentation is acne, and this is understandably so because acne is the most common skincare condition. So with a lot of people suffering from this is the leading cause of post-inflammatory hyperpigmentation. Now, other causes are insect bites and then trauma to the skin from wrong skincare practices like dermabrasion, wrong use of chemical peels, post-surgery. Now, another cause is also allergic skin conditions and then chronic inflammatory skin conditions like psoriasis. Now to the crux of the matter. How do you prevent post-inflammatory hyperpigmentation? Now, prevention of post-inflammatory hyperpigmentation starts with preventing these causes in the first place and then promptly treating the inflammatory skin conditions. Now, when you do this, the dark marks that are left, they are not going to be as severe and they'll clear up faster. Now, for acne, which is the leading cause of post-inflammatory hyperpigmentation, you want to have a skincare routine that is tailor-made for oily, acne-prone skin. You also want to use skincare ingredients for oily skin. You want to avoid harmful skincare practices that can worsen your acne or leave you prone to acne. Now, I have a blog post where I shared a simple skincare routine for oily, acne-prone skin. I also made a video on the very 5 best skincare ingredients you want to look out for when you're getting your skincare products. I'll link it up here and in the description bar. I'm going to be linking a blog post in the description bar, a simple skincare routine for oily skin, and then the video where I shared with you guys the 5 best skincare ingredients for oily, acne prone skin, and then skincare mistakes that can leave you oily and acne prone. Another important way to prevent PIH is to avoid popping your pimples. Now, when you pop your pimples, what you do is you drive the inflammation deeper. And as I said earlier on, with more inflammation, more melanocytes are recruited to try to heal the skin. And with more melanocytes being recruited, you get more melanin being formed that will be deposited on this area. So you have more hyperpigmentation that will take longer to clear. We don't want that. And you'll also be left with pitted acne scars, which are not cute. Now, the mainstay in the prevention of post-inflammatory hyperpigmentation is to use sunscreen daily. You want to use a broad spectrum sunscreen that protects both from UVA and UVB rays. So you want to opt for a sunscreen that is SPF 30 and above. Now, you want to apply every 2 hours. You want to use this every single day, irrespective of whether you're stepping out or whether the day is cloudy or sunny. You want to end your morning skincare routine with a sunscreen. Another way to prevent post-inflammatory hyperpigmentation is to use gentle skincare products. We want to use mild skincare products that are not overly drying. We don't want to irritate our skin with harsh ingredients that are going to leave us dry, alter our skincare barrier, and trigger inflammation. We don't want that. We also don't want to use very harsh skincare practices like using physical exfoliants that will cause micro tears. These micro tears can trigger inflammation that will leave us with rebound hyperpigmentation. We don't want that. Another way you can prevent post-inflammatory hyperpigmentation is to calm the inflammation that arises from insect bites or other inflammatory skin conditions with a low-dose corticosteroid cream. Now, you don't want to use these creams for extended periods of time, so you just use them for a short amount of time to calm the inflammation. Treatment of post-inflammatory hyperpigmentation on dark skin can be very tricky. You always want to err on the side of caution because we are prone to forming rebound hyperpigmentation. The first way you can treat post-inflammatory hyperpigmentation is through regular exfoliation. Exfoliation is the sloughing off of dead skin cells. Now, this is a natural process, but as we age, the ability of the body to slough off dead skin cells wanes. So you want to assist the body to do this. You want to exfoliate using chemical exfoliants rather than physical exfoliants, as these have been shown to cause micro tears. Now, the chemical exfoliants you can use are alpha hydroxy acids like lactic acid, glycolic acid, and mandelic acid. The other one you can use are beta hydroxy acids like salicylic acid. Now, for those of us with darker skin tones, it's better to exfoliate with the milder acids like salicylic acid, lactic acid, and mandelic acid. Now, these are going to mildly exfoliate the skin without causing too much inflammation that can trigger rebound post-inflammatory hyperpigmentation. You want to exfoliate at least once a week, and you don't want to go more than 3 times a week. Now, the second way to treat post-inflammatory hyperpigmentation is through chemical peels. Now, a chemical peel is a wonderful process to improve skin texture, treat hyperpigmentation, treat acne. It even takes care of fine lines and wrinkles, but if it's done wrongly on dark skin, it will do more harm than good. So chemical peels work very well for those with fairer skin. But for those of us with darker skin, we can also do chemical peels, but we don't want to go deep with these chemical peels. Now, there are 3 types of chemical peels. There's a superficial chemical peel, there's a medium chemical peel, and there's a deep chemical peel. Now, for those of us with darker skin tones, we want to do just the superficial chemical peels and then get professional help with the medium chemical peels. Now, the deep chemical peels are a no-no for those of us with dark skin type. Now, the deep chemical peel causes severe inflammation that triggers scarring, that even defeats the aim of getting the chemical peels in the first place. So now, another way to effectively treat post-inflammatory hyperpigmentation on dark skin is through the use of brightening and whitening skincare ingredients. A lot of the ingredients I'm going to mention today have anti-tyrosinase activity. Tyrosinase is an enzyme that is needed in melanogenesis, that's melanin production. Now, some of these ingredients can boost collagen, they have anti-inflammatory properties, they can even out your skin tone, brighten your skin, and they also have antioxidant properties. So I'll be coming up with another video where I will go in depth into the skincare ingredients you need to treat your hyperpigmentation. But in today's video, I'll be mentioning these skincare ingredients just so the video doesn't get to 20 minutes. So stick around for that video. Now, the skincare ingredients you need to look out for when you're treating hyperpigmentation are vitamin C, retinoid, niacinamide, azelaic acid, tranexamic acid, alpha-butene, kojic acid, and hydroquinone. So stick around for the video I just told you guys about, where I go in depth into these skincare ingredients, okay? Now, the fourth way to treat post-inflammatory hyperpigmentation is to get a laser peel. Now, a laser peel is a resurfacing treatment where light is used to target areas of hyperpigmentation. Now, just like the other ones, you have to do a laser peel with caution when you have dark skin for the sole aim of preventing rebound hyperpigmentation. Now, this procedure is very effective when done correctly, but it's usually reserved for severe acne and severe hyperpigmentation. So guys, if you enjoyed the video, please give it a thumbs up, click on the subscribe button below, and turn on the notification bell so you know when I upload another video. See ya!